So this year at the American Society of Clinical Oncology, I'll be doing an update on when and how to use checkpoint inhibitors in lymphoma. So we'll start by covering Hodgkin lymphoma because we know that genetic alterations in the 9p24.1 has led to more PD-L1, PD-L2 expression, which we think translates in escape or immune evasion for the lymphoma cells, resulting in higher efficacy with single agents, pembrolizumab and nivolumab in relapsed refractory Hodgkin lymphoma, which ultimately resulted in approval for both of those agents in that setting. So we'll cover that data, including some of the updates, briefly touch upon some of the biomarkers that may predict for response in those patients, and then talk about where this is evolving. So in Hodgkin lymphoma, it's relatively easy to cover because it's moving into earlier lines of therapy. So we'll cover some of the data with nivolumab in combination with brentuximab vedotin, and even some of the frontline studies where it's being incorporated into standard chemotherapy regimens. Outside of Hodgkin lymphoma, the role for checkpoint inhibitors is less clear, meaning some of the efficacy is not as great. We will cover pembrolizumab and the activity in primary mediastinal large cell lymphoma for relapsed refractory patients, which shows an efficacy of an overall response rate of approximately 40% in phase 2 study, again in the relapsed refractory setting. This provides an option for patients who have failed standard therapies and oftentimes will progress and ultimately succumb to their disease before we can even move on to that next line of therapy. So this is potentially practice changing. And then lastly, we'll briefly touch upon other subtypes of NHL, such as follicular and large cell, where the activity has been less promising. In those areas, either combinations or predictive biomarkers will be necessary to continue the use of checkpoint inhibitors in those subtypes. So I look forward to covering this. It'll be a brief session and it will be incorporated into the discussion of other immune therapy options such as CAR-T, which is also equally exciting in lymphoma right now.